Well, it's a question you probably heard or even thought about since you got your driver's license, being asked about being an organ donor. While thousands of transplant surgeries are performed each year, even more people are still waiting, with the most recent data finding that approximately 13 to 17 people die each day while waiting. So in honor of Donate a Life Month, which takes place in April, we are taking some time to learn more about organ donation. Joining me to tell us all about it and more is Dr. Matthew Wynn, a transplant surgeon with HCA Health One, Presbyterian St. Luke's. Thank you so much for being here.
Of course, thank you for having me. It's a pleasure to talk.
It's such an important issue. As we talked about before, you know, my brother-in-law had a double lung transplant, and it was because of that he had a life extension. So for me, I'm always like, make sure if you can, donate your organs, otherwise they just go to waste. First, can you tell us about, because I know that a lot of people get confused on who qualifies as a donor.
So basically everybody qualifies as a donor. We have donors as young as less than a year old, and we have donors older than 100 years old now. So everybody qualifies. I always encourage all of my friends, my family, that you can go to the DMV when you do your driver's license, or you can go to a website like donatelifecolorado.org, where there will be tutorials about how to become a registered organ donor.
And I think a lot of people also may not know, and I didn't know until I unfortunately had to go through personal experience, but there's a long list of people waiting to receive these precious life-saving organs, and then they get scored depending on the urgency. Mm-hmm. And so there are a lot of people, like we just said, that do not receive those organs, and then they lose their life. So how does that work? Walk us through, like, how does somebody get, let's say, one organ in front of another?
Right, so there's different systems for each different organ. So for example, kidney transplant, it's really just a list, and it's about how long, somebody's been on dialysis, which is the kidney replacement machine, or just how long they've been on the list in general. Whereas for something like a liver or a heart, it's scored based on how urgent they are, how sick they are. So the sickest people are able to get an organ faster because we really don't have that same replacement machine for a heart or a liver.
Right. And if somebody is a living donor, right, which is incredible, what would their recovery be like? What are some things that they should consider?
So nowadays we do this with minimally invasive surgery. We either use cameras, small instruments. Most of the time we even use the surgical robot.
Oh, wow.
So the recovery is usually pretty quick. So I usually tell my patients, it's usually a night in the hospital, and then a couple of weeks of recovery, and then you're usually back to your normal life within a month.
Wow. While helping someone save their life, right?
Absolutely.
I mean, that's something you can go to bed at night feeling like you accomplished a whole life's goal. Talk to us about some of the misconceptions when it comes to living donors.
I think the biggest thing is that there's no real set limitations. So we encourage everybody to reach out. Anybody who has a loved one, a friend, a family member, a colleague, or even someone who's interested in donating to a stranger, I encourage them to reach out to an organ transplant center. And, there's a form that you fill out. We find out if there's, it's a great way to have a health screening. But also we find out if you're a candidate to be an organ donor. But I encourage everybody to reach out.
And how would you be a candidate?
So as you fill out this form, we make sure that you don't have any big red flag medical problems. And then we do a very extensive evaluation. So it's a whole panel of testing. And then we talk extensively about this because it's obviously it's something that we as surgeons and as a medical community, we want to make sure that we're doing right by everyone. And this is something that it's a gift that someone is willing to give, and we want to make sure that person is going to be safe and is going to have a long, healthy life afterwards.
Well said, Dr. Wynn. So again, when you're at the DMV, make sure that you click that box to donate your organs, and then also go to a donor organization website. There's a lot of them out there to hopefully help out. Thank you, Dr. Wynn. We appreciate you today.